My name is Sich. I'm one of the surgical oncologists here at Logan Health, and I specialize in cancer surgery. Cancer at its heart is an abnormal growth of cells. That's kind of the simplest explanation for it. When cells start to divide outside of their control mechanisms that keep them from becoming a cancer, they will either form solid tumors or they can form abnormal growths in the bone marrow or in the blood. And those lead to eventually tumors that can spread and metastasize, and that's a short version of cancer. So for women, there's going to be the things that come to mind that are pretty frequently publicized. So breast cancer, cervical cancer, ovarian cancer, uterine cancer, endometrial cancer are some of the big ones. But I also kind of want to highlight the ones that you may not think of that are not specific to women, but just as common or more common than some of those I just listed, which is going to be things like colon cancer, lung cancer, other things depending on your risk factors. For women, it's going to vary based on age. Cervical cancer screening starts at 20 usually. It's a pap smear every 3 years. Once you get to 30, that gets spaced out to every 3 to 5 years. Breast cancer screening generally starts with a mammogram. That starts at age 40 now. We've kind of coalesced around most of the society guidelines recommending age 40 for that. That's going to be every 2 years unless you have other risk factors that prompt it more frequently. Colon cancer screening starts at age 45 in everyone. And lung cancer screening, if you've ever been a smoker, starts at age 50. And I would say a caveat to all of these things, if you have a family history of cancer, then that often will drop that age down, sometimes dramatically, as early as in your 20s or 30s for some of these cancers. And that's something that you should discuss with your family care doctor. For cancer care, it's divided up based on what each discipline does. So we have lots of different doctors that participate in cancer care. My job is kind of the surgical arm. So surgical oncology deals with exactly how it sounds, cutting cancers out. But that is just one pillar of cancer care, and we rely on a team of doctors to take care of cancer. That's going to include medical oncologists, radiation oncologists, sometimes plastic surgeons, other different disciplines of surgery, urology, gynecology gets involved, particularly in women's cancers. So it's a whole host of doctors that take care of it, but our arm is the surgical arm.